Let me start by sharing the story of my friend Joe Callahan, a retired school principal. At 78, he was in good health and swore by his daily hot baths. One winter evening, like always, he relaxed in a tub filled with water over 107 degrees Fahrenheit. But that night, something went wrong. Joe felt lightheaded, stood up, and collapsed. He lost consciousness. His wife found him on the bathroom floor, cold and unresponsive. He was rushed to the ER, where we diagnosed him with severe low blood pressure and a dangerous irregular heartbeat. He spent several days in the ICU. After he recovered, he admitted, "I ignored your warnings for years. I thought it wouldn't happen to me." Joe's story is not rare. As we age, our bodies change, especially how we respond to temperature, water loss, and even balance. What was once a harmless routine can become dangerous, and it all begins with the first of 5 risky habits. 1. Prolonged hot baths. Soaking in hot water may feel comforting, but for older adults, it can lead to a sudden drop in blood pressure. Why? Hot water causes your blood vessels to widen, and when you stand up after sitting in hot water, your blood can suddenly shift away from your brain. This can make you dizzy, lightheaded, and even cause fainting. Seniors over 65, especially those with high blood pressure or heart issues, are much more vulnerable to this effect. In some cases, it can lead to falls, head injuries, or cardiac complications. A safer alternative is bathing in lukewarm water, ideally below 100 degrees Fahrenheit, and limiting the time to no more than 10 minutes. Drinking water before and after bathing helps keep your circulation steady and prevents sudden blood pressure changes. 2. Daily soap usage. Here's something most people don't realize. As we age, our skin produces less oil. By age 70, it's less than half of what we had in our 20s. When you bathe every day with soap, especially all over your body, you strip away your skin's natural oils, leaving it dry, cracked, and irritated. I remember one patient, Mrs. Eleanor Martinez, who came in complaining of severe itching and dryness. She was bathing daily, using scented soap from head to toe. Her skin was inflamed with tiny cracks, which opened the door to bacteria. A simple itch turned into an infection that required antibiotics and a hospital stay. Studies have shown that elderly people who use soap more than 4 times a week are 60% more likely to suffer from dry, irritated skin. And dry skin isn't just uncomfortable. When you scratch it, it breaks, and broken skin in older adults can lead to infection quickly. So what's the right way to bathe? Use soap only on the necessary parts, underarms, groin, and feet. The rest of your body usually doesn't need it. Use pH-balanced soap, and always apply moisturizer within 3 minutes of drying off. That's the window where your skin can absorb hydration best. 3. Unsafe bathroom setups. Falls are one of the most common and dangerous injuries for the elderly, and the bathroom is the most hazardous place in the house. The combination of slippery floors, water, steam, and sudden temperature changes makes it extremely risky. In my practice, I've seen countless seniors end up with fractured hips, bruised ribs, or worse, all because of a fall in bathroom. One patient, Mr. Tom Wilson, slipped while stepping out of the tub and fractured his hip. Though he had surgery and physical therapy, his walking was never the same, and his independence declined sharply. Statistics show that 38% of bathroom falls among seniors happen during or immediately after bathing. And if you're over 80 and suffer a hip fracture, your 1-year mortality rate goes up to 25%. To prevent these falls, a few simple modifications can make a huge difference. Install non-slip mats inside and outside the tub. Add safety grab bars near the toilet and bathing area. Consider using a shower chair. It reduces fall risk by more than 90%. These tools are inexpensive but can be life-saving. 4. Temperature drop after bathing. This one surprises many people. After a warm bath, your body can actually get cold very quickly. Why? Because the heat dilates your blood vessels, and as soon as you're exposed to cooler air, your body loses heat faster, just like a hot cup of tea cools down quickly in a cold room. I treated a 92-year-old woman, Mrs. Helen Peterson, who ended up in the emergency room with hypothermia. She had taken a warm bath, but didn't dry off immediately. She sat in her robe in a cold room, and her body temperature dropped dangerously low. Older adults have reduced ability to regulate body temperature, and a warm bath followed by cold air can trigger chills, dizziness, or worse. The fix? Preheat the bathroom if it's cold. After bathing, dry yourself completely with a warm towel. Wear cozy clothes immediately, and cover your head if your hair is wet. A warm drink, like herbal tea, can also help your body hold on to heat from within. 5. The myth of overcleanliness. There's a common belief that more cleanliness equals better health. But this isn't always true, especially for seniors. Our skin is home to billions of beneficial bacteria. This is called the skin microbiome. These bacteria protect us from harmful germs. But daily soap and overwashing can destroy them, leaving your skin exposed and vulnerable. Younger people can replenish these bacteria quickly, but after age 70, the skin's microbiome takes much longer to recover. Research shows that seniors who bathe daily with soap all over have 35% lower skin immunity than those who bathe 2 to 3 times a week. A woman I once treated, Mrs. Carol Garcia, was 83 and proud of her spotless hygiene. She bathed daily with antibacterial soap and scrubbed thoroughly. Every winter, however, she'd come to my clinic with skin infections. She didn't understand that her habits were breaking down her skin's natural defenses. So what should you do? Limit full-body soap usage to twice a week. Clean odor-prone areas regularly, but rinse the rest with water. Avoid harsh antibacterial soaps unless prescribed. And consider using a humidifier indoors. Dry air can make your skin even more vulnerable. In closing, I'm not telling you to stop bathing. I'm asking you to change how you bathe, because what worked in your 30s may not work in your 70s. Here's what safe bathing looks like after 65. Bathe 2 to 3 times per week. Use lukewarm water, not hot. Keep baths under 10 minutes. Use soap only where needed. Moisturize immediately afterward. Prepare your bathroom for safety. Keep your body warm after the bath. Maintain healthy indoor humidity. These simple steps can protect your skin, prevent falls, avoid infections, and ultimately extend your life. So the next time you're about to step into that hot bath for 30 minutes, pause and ask, is this helping me or hurting me? Because at this stage of life, even a small habit can have a big consequence. In your life, 5 habits people over 65 must avoid.